When somebody complains of being dizzy, you need to know what they really mean, because there's two kinds of dizziness. One is lightheadedness. Everybody has had a feeling of giddiness, of lightheadedness, and they call it dizzy. For instance, when you get a common cold and you're laying down in bed and you suddenly stand up and you feel, ooh, like you're going to pass out. Or people, when they get older, when they first get out of bed, they need to stand up for about 30 seconds, hold on to a table, because they're dizzy, they're lightheaded. The blood is dropping down to the toes and it has to catch up coming to the head. The same thing happens when somebody has that common cold. So lightheadedness, giddiness can be due to that. It can be due to medications that you're taking, blood pressure medications. So it's something that has to be worked out with your doctor. The other thing is vertigo. Some people, when they think of dizziness, they think of the room spinning around and around and around. There is benign positional vertigo. Suddenly change my head and boom, the thing spin. Lay down in bed and you change the angle of your head and woo, the room spins around. There's a semicircular canal in the inner ear, and what happens, there are some little crystals. It's usually in the posterior semicircular canal that float around, and if they're floating around, they cause vertigo. There's a new procedure that an ear, nose, and throat doctor or some physical therapist can move in certain positions that will get those crystals to go out of that posterior semicircular canal, and all of a sudden your dizziness, like magic, has gone away. Other people, it's an inner ear problem. There's a Meniere's disease where people have true vertigo, they have hearing loss and ringing of their ears. This requires a specialist if you have Meniere's disease. Sometimes allergy can be a cause of that, but usually it's damage that's been done on the inner ear that causes that type of vertigo. See your ear, nose, and throat specialist.